everyone, I'm Shabeli. I'm a board certified anesthesiologist assistant. I want to show you a week in my life. I did take a lot of videos for the past week. I do feel like the video is going to be pretty long, so I have split it up into a couple of parts. And for any new viewers, I just want to reintroduce myself. I'm Shabeli. I'm currently working administering anesthesia in the state of Florida. Anesthesiologist assistants overall can do a variety of things regarding anesthesia, and I hope to show you some of the variety of things that we can do within this video. And it would mean a lot if you subscribe to this channel. All right, now let's get into the video. To start off my week, today is Sunday. Me and my boyfriend are getting some food in one of our favorite restaurants. And we're getting pizza and it's gonna be really yummy. And then we're gonna go run errands and get some food for the week. So successful day of running errands. And today is the night before my week, so I've just done my skincare routine, and I always get my clothes ready for the next day and put it to the side so it's ready to go, and I'm not looking around in the morning for my clothes. Just gonna relax and go to sleep. Every morning I give myself a little bit of a routine to relax myself before I start my day. I do my skincare, I get my coffee, and I take my nutrients. I do have a first year student that I've worked with a couple of times that has set up my room. We are doing a general case, we're doing a GYN, if it was a dilation and curettage. So an LMA was enough, and I just wanted to double check what she had done in terms of setting up the room. I did notice that the SIVO agent, which is an inhalational agent, was not filled up, so I wanted to fill that up. Also, I had to review the patient chart, and then I went and met the patient. Soon after, I drew up the drugs I would need to provide anesthesia. So I drew up propofol. I also drew up fentanyl to reduce any pain associated with this procedure. During this time, I was just making sure that all of their vital signs were normal, that their breathing is well controlled within normal limits. Their pressure went down a little bit, so I gave a little bit of phenylephrine, which is going to increase their pressure. And now it was the end of the case, so I had to turn down the agent. I also had to make sure that the patient was breathing on their own. I also make sure I chart that. So we are now in a new room. Last case was an LMA for a general procedure, a GYN procedure. In this case will be again general, but with an ET tube. And now we're doing the machine check because we have changed rooms from the last room. I have my student over there working on something. My student is working on setting up the syringes, and Airway is set up. So we have our monitors ready. EKG is ready. Suction, mask with eye tape, protect the patient's eyes. We have our tube ready and our blade, and we have our OG temp probe. And this is an extension because it's robotic, so that patient's arms won't be accessible. So we always want to have a second IV in case the first one stops working. Again, the arms will not be accessible during the procedure, so we have a backup IV ready here. Okay, that's finishing up. The glide scope is also ready because this patient looks like she could be a little challenging for this procedure, so we'll have that extra caution set up. I had some time between the two cases and I took a morning break, and then it was time to put this patient to sleep using propofol. After everything was settled in, I had to take care of the patient, make sure, again, all the vital signs are normal, catch up the chart, make sure that everything is accounted for, all the drugs, all the vital signs look like they're up to date. This patient also had diabetes, and their glucose was abnormal before the surgery, so we had to check it during the surgery. So we checked and it was also abnormal, so the patient's blood sugar would have to be corrected during her stay. Towards the end of surgery, I initiate getting the patient off the ventilator by checking the paralytic reversal status with this monitor. I also turned down the inhalational agent, which keeps the patient under general anesthesia. The patient was breathing well without help from the ventilator in the end, so they were extubated and transferred to the recovery area. And right afterwards, I got my lunch. My room is done for the day, so I'm going to give my coworker a break now. I just gave myself lunch, and I'm going to go give him lunch now. I ended my day filling out charts for the next day for patients that we would be having tomorrow. It just gives us a little bit more information before we meet them. Then I clocked out. I also picked up some groceries for dinner. I work 5/8, so it gives me a good amount of time to go to the gym, and I've been trying to be as healthy as I can since I've started working. I try to eat healthy meals as well too. I just got the scrub cap from Etsy, and it is the best. It has satin on the inside, and it's been helping my curly hair with the frizz, and I feel like it just helps overall in the week. So of course, getting ready for the day, getting my skincare routine, and getting my coffee. Today I have a later start, so I'm on my way to work. It's about 7:30. I'm working with one of the new surgeons, which is gonna be nice. He's really nice overall, so great day is ahead. So I'm excited, and we'll see what I get into today. So for my first case of the day, it is a procedure around the rectum. So I think I'll be okay to use an LMA, but I'm going to talk to the patient and get more information about this mass, and I'll be ready to convert to a general anesthetic with a tube if necessary, but for now I'm just going to quickly put down an LMA. Size 4, since the patient is male, and have a backup LMA open, and I'll get this ready and to the side. I'm going to finish my room setup by setting up my monitors. I make sure that it's organized and very easy to access so I can put it on the patient right away. Every monitor that we do is important. One of the most important monitors is the EKG. It will tell us the patient's heart rate, it will tell us the patient's rhythm, and it's also important to make sure that you subscribe to this channel. Once my room was all set up, I went over to pre-op and interviewed the patient and got their history from them. The patient may have a challenging airway, and we want to protect it and be efficient about it. So we have the glide scope in the room, and we will also have the bougie ready should we need it for the airway placement. We're gonna aim for an LMA, and we may need to convert, so we have our backup equipment ready for this patient. This is the bougie, which is a backup in case we're struggling with the intubation. This should be able to feel the tracheal rings and guide the endotracheal tube. So I'll also have this out and ready for this potential difficult airway. In case we will need to intubate, I have succinylcholine ready, which is a quick paralytic. It's the fastest onset paralytic. With this, it'll be less time that we need for the patient to get the paralytic on board and for the vocal cords to open up so that we can place the endotracheal device. So we need to be quick when we need to place this endotracheal device if this patient is difficult to manage, and that's why we have succinylcholine ready. And also something important about succinylcholine is that potassium levels are very important with administering succinylcholine, because succinylcholine will slightly increase the potassium levels temporarily. If a patient has high potassium levels, that can cause a heart attack or can cause a patient to code if we mess with the potassium levels and they become out of range and are way too high for this patient. So this patient is within normal limits. Succinylcholine is okay to use. It'll be quick, and hopefully we can secure this airway very smoothly. So lidocaine, this is to numb up the vein before a patient gets propofol. Propofol is the induction agent. It will put the patient to sleep. However, it does feel uncomfortable in the vein because it has a different pH than what our blood is used to, so it actually gives a burning feeling for some patients. So we try to numb up the vein with lidocaine first. So hopefully we just need to do an LMA and place it with these two agents. Other than that, fentanyl for the procedure itself, or if we actually end up converting to an endotracheal tube placement, and phenylephrine. This patient has hypertension, and although their blood pressure seems to be normal, propofol has cardiovascular depressant effects. So we want to have phenylephrine ready to bring blood pressure up. So we have our phenylephrine syringe ready. This is for in case we convert to the endotracheal tube placement. We'll have our paralytic ready. And again, we need this because we want the vocal cords to be open for the endotracheal tube placement. This is very quick acting. We have made sure that the potassium levels are within normal limits. Well, I have a little bit of time before my surgeon shows up, so I'm gonna grab a quick snack and water. While waiting for the surgeon, I did some quick paperwork, and then we found out that the patient would be facing down, prone position. So we would need to intubate this patient because of how difficult they would be to manage, especially in that position. We wanted to make sure that area was nice and secured while they were facing down and in the prone position. I drew up propofol, which was the induction agent. I had lidocaine ready to numb up the vein. I had succinylcholine, the paralytic, and I also got fentanyl, which is a controlled medication, so I need to put my fingerprint in. And I drew up 2 cc's of that, which is 100 mics, and that would help blunt the stimulation from placing the endotracheal tube and also help with the stimulation from the actual surgery itself. Once my case was settled in, I got an official morning break from one of my coworkers. My job is amazing about breaks, and we really do our best to give each other breaks, and it just helps feel supported during the day and get our energy up. After that case was completed, I went over to OB. I was involved in giving the anesthesia for a C-section. This procedure, I'll be doing a spinal And sterility is super important, so we have sterile gloves. The patient is prepped with this chlorhexidine, and then this is prepared completely sterilely for the patient as well. And anything that's added into the spinal must be completely sterile as well, because it's going into the CSF, which is connected to the brain, and there is no blood-brain barrier from the CSF and the brain matter, so you cannot have any infections. I really enjoy the variety that OB gives in terms of administering anesthesia. There are different medications that we have to give for OB. There's different things that we make sure are done while we're in OB, so it's really nice to be a part of a team that does OB. Okay, just finished a nap and it's about 7 p.m. I didn't eat a lot today, so I think I got tired when I got home, so I just napped. I do think I want to make a video about what I eat in a day, if anyone's interested in that, to keep me energized. Tomorrow I'll have my food ready. So right now I'm gonna go to the gym, and tomorrow's gonna be a very busy day, so I'm gonna get ready for that soon. But of course, I wanna hit the gym as much as I can, and my boyfriend always reminds me, makes me feel a lot better, so that's what I'm gonna do now. I hope that you all like this video. I hope that if you're considering a career in healthcare, that anesthesiologist assistance is one of the many paths that you're looking into. And if it is one of them, and if you're a part of a pre-med club, it would be awesome if you could share this video, if you could help spread awareness. I've worked with residents who have said they wish they knew about the anesthesiologist assistant profession before they went into medical school. And so I feel like it's really valuable to become aware and spread the information to anyone that might be looking into a career in healthcare. I truly think it's such an amazing career. It is one of the hidden gems of the healthcare field. I really hope that more people learn about this profession as a whole. And if you like this video, please support this channel by hitting the like button below. Also, please let me know if you want to see more vlog videos or if you want to see more of me talking through a topic. I can do either. I really like doing both, so just let me know what you prefer. Otherwise, I hope you have a great week, and I'll catch you all next time.